Okay, great. So, hello students, I'm starting the class. Is the audio video okay? Just let me know, is the audio video okay? Okay, friends, I'm starting the class. Just let me know if the audio video is okay. Okay, Ronak says it's okay. Let just me see one or two member also. If they say it's okay, we'll start. Okay, fine, great. Okay then. So I'm Dr. Ajay Yadav, anesthesia faculty. So let's start. Before starting this, I would like to tell you a few things about notes. I think you would have taken the printout of that notes. So basically, the purpose of that note is for images, because of course you cannot draw images. And why I ask you to take printout, so that if you want to note something regarding image only, you can note it there. And second is to discuss MCQs, because after every chapter we are going to discuss MCQs related to that. And maybe sometimes, like in CPR, where there are long algorithms or tables, which of course you cannot draw, so we don't want to waste time in that. That also had been included. Otherwise, you have to prepare your notes at your own. So at every slide, I'll try to stop for the considerable time, so that you get enough time to make your notes. But anytime if you feel that I'm going too fast, then just let me know through Telegram group. So I'll try to get it slow. And don't worry, by chance if you miss something, also nothing to worry about, because I will post this annotated PDF on this group later. So fine. So uh, so don't worry about that. So let's start. PDF is already there. I think somebody who have not joined maybe could not see. So I'm just forwarding. It's already there. So I'm just reposting it. These notes are there. Yeah. So these notes are already there. If you somebody who have joined latest, maybe they are not able to see it. Fine. Okay, then let's start. So in this section, to begin with, what we are going to discuss is just one or two points about history, and secondly, anesthesia delivery systems, means the systems which are required, or the equipment which are required to deliver the anesthesia to the patient, and then important equipments which are imported from anesthesia point of view and resuscitation point of view, equipments that we are going to discuss. So let's start with history. And of course, as I told you, no need to go in details of the history. In books you will find uh, anything. History is quite large, so of course they don't expect that much from you to know about the history of anesthesia. So just I will say the two most important thing which you must know in history is that first public demonstration of anesthesia. And that first public demonstration of anesthesia was given by William Thomas Green Morton. Or just if you can remember Morton, that should be enough. You no need to remember even full name also. Morton, on 16th October 1846. Date is important here. If you don't want to remember, forget it. But date is important. Why? Because even today we are celebrating 16th October as World Anesthesia Day. So even today we do celebrate 16th October as World Anesthesia Day. Then second very important landmark I will say is first spinal anesthesia in human beings, and that was given by August Bayer. And very interesting fact about this, that this first spinal anesthesia, who was the subject? August Bayer subjected himself for first spinal anesthesia, and it was given by one of his friend and colleague. She was physiologist, and when it became successful on August Bayer, the second victim was his friend, that physiologist. Then he gave to her. So, but these are really something big to try on yourself for the first time. You really need guts to do that, and that's why today also we remember these people. So first public demonstration of general anesthesia, and Morton used ether. So sometimes they may ask you first ether anesthesia. So first public demonstration of general anesthesia, that was done with ether, and that was done by Morton on 16th October. And as I told you, why we have to remember the date, because even today we are celebrating 16th October as World Anesthesia Day. And second very important landmark in history, as I told you, is first anesthesia in human beings, and that was given by Bayer, August Bayer. And as I mentioned, that he subjected himself for first spinal anesthesia. So these two are the most important point in history that you should know. Now, let me see if there is any technical glitch or something. Okay, Saguna says I cannot see the notes, but I can. It's opening nicely, Saguna. It's opening. Yeah, they're opening nicely. Okay. Sam has sent again. So thank you, Sam. So there is no other technical glitch. Fine, great. So let's go to our next section, that is anesthesia delivery system. What do you mean by anesthesia delivery system? As the name suggests, means the system or the equipment which are used for the delivery of anesthesia to the patient. And to deliver anything, what you need? You need a source, a processing unit, and then some delivery system. Like, for example, say you order something from Amazon. How it works? There will be warehouse, that is a store. From that warehouse, your merchandising will reach the office where they will process. Process means packaging and everything. They will do address and everything, and from there, through delivery boys, it will be delivered at your doorstep. So same way you can think about anesthesia delivery system. There has to be some source. There has to be some source of gases. From that source, gases will be delivered to the process unit. And what is our process unit? That is the anesthesia machine. So process unit, you can say, is the anesthesia machine. And from anesthesia machine, through the delivery tubes, anesthetic gases will be delivered to the patient. So that's how we will read. First, we will see the sources of gases. Then from sources, gases reaches anesthesia machine. We will see that what all processes happened in anesthesia machine. And then about these tubings, which are called as circuits, breathing circuits. Then we'll discuss these breathing circuits. And from these breathing circuits, then gases reaches the patient interface, mouth or nose. Then from mouth to nose, to deliver them to the lungs, we need some equipment, and that equipment we are going to discuss in next section. That's how we are going to discuss our anesthesia delivery system. Fine. So just let me see any technical glitch. No. Okay, great. So let's start the source. source of the gases. So the source of the gases may be cylinders, gases may be stored in cylinders. So source of gases could be cylinders. So let's discuss about first cylinders. So cylinders are made up of molybdenum steel. And why actually they are made up of molybdenum steel? Because molybdenum steel can withstand very high pressures, and the pressures in cylinder is quite high. So to withstand that high pressure, we need a strong steel, that is molybdenum steel. So the two most important thing about cylinder that you have to know, one is the color and second is the pressure. So two most important thing about cylinder that you should know is the color and the pressure. So color of oxygen cylinder is black body with white top, or you can say white shoulders. And you can see also these are oxygen cylinders, black body with white top or white shoulders. So oxygen, black body with white shoulders. Regarding pressure, so many units are being used in different countries: Pascal, kilopascal, PSI. But of course, you need not remember about other countries. You have to remember only about India. And in India, the two units which are being used are kilogram per centimeter square and pounds per square inch. Later, we'll always write as a short form PSI. So you can remember in one unit, and always, almost always, I have seen the question has been asked in PSI. So you remember in PSI, and you can remember the conversion factors, because by chance, if they ask in kilogram per centimeter square, you can convert by multiplying or dividing PSI by 14.5. So 1 kilogram per centimeter square is equal to 14.5 PSI. So in a full oxygen cylinder, the pressure is 2000 pounds per square inch. So in a full oxygen cylinder, the pressure is 2000 psi, which by chance, if they ask in kilogram per centimeter square, if you divide by 14.5, so it will come somewhere around 1 kilogram per 140 kilogram per centimeter square. Now you would have seen that there are different sizes of the cylinder. This is a very big cylinder. You can see the size of the cylinder. All on the other hand, you would have seen such a small size cylinder that is used in bag for resuscitation. So there are many different types of cylinders which are being used, but of course you need not remember all those details. Just what you can remember is that the most common type of the cylinder that is used on anesthesia machine, attached to anesthesia machine, is type E. And the most common type of cylinder that you will see being used in wards or even in ambulances for transport, that is type B. This is actually type H. So this is a photo of our central supply room where we are storing or our storage room where we are storing the cylinders. So they are the large cylinders. Otherwise, in ward, sometimes you see these big cylinders also, but the most commonly you see is type B cylinder. Now, another important thing that you must know is the quantity in the cylinder, because this actually become very important during COVID, that you should know that how much oxygen is present in this cylinder. So in a so again, I told you no need to discuss about every cylinder, that details are not expected from you. Since the most common use type is B, so we have to know the content of B, because even if you are transporting a patient in ambulance or in ward also, you will see the type B cylinder. And type B cylinder has around 1600 liters of oxygen. So that is how nowadays question they are asking, that if you are giving say 10 liter of oxygen per minute to the patient, how long your cylinder is going to be last. So 10 liter per minute means in 1 hour how much? 10 liter multiply by 60 means 600 liter we are using in 1 hour. Means a full cylinder is going to last how long if you are using 600 liter per hour? Around 2.5 hours. 600, 1200, 1500. So around 2 hours, 40 minutes, something you can say around 2.5 hours. So that is a kind of question they are asking nowadays very commonly. And sometimes they say you are transporting a patient with type B cylinder, which is half full. So how long it is going to last? So means 800, or sometimes they make this little difficult. They will say you are transporting a patient or you are giving oxygen to a patient and you noticed in ward that the cylinder pressure is 1000 psi. Then how long it is going to last? 1000 psi means half full. 500 psi means one fourth full. So if they say pressure was just 500, how long it is going to last? So even not 1 hour. Or if they say it is half pressure is 1000 psi means half full. That means this cylinder is going to last around 1.5 hour. So these kind of questions are very commonly asked nowadays regarding the consumption of oxygen. I hope now it is clear. So full cylinder is 2000 psi. If they give 1000, half means half full, 500 means one fourth full. So accordingly you can calculate, and the content, even if they don't say which kind of cylinder you are transporting a patient, assume that it is type B and the content will be 1600. That's it, because they don't ask about other type of cylinders, because in ambulance everywhere in ward also it is type B which is being used. Correct. Now let me see any technical glitch. No. Okay, great. Then second cylinder in common use is nitrous oxide, which is stored in blue color cylinders. You can see blue cylinders at a pressure of at a pressure of 760 pounds per square inch. 760 psi. So nitrous oxide is also commonly used, and it is stored in blue color cylinders at a pressure of 760 psi. Carbon dioxide is stored in gray color cylinders. However, carbon dioxide is not used in anesthesia, not at all. But still, you will see carbon dioxide cylinders in OTs being used for gas insufflation for laparoscopic surgeries. So, anesthesia side, we are not using carbon dioxide. Only surgeons are using for gas insufflation during laparoscopy. Air. Again, air is almost always supplied actually through central supply, but still as an extra edge, if you want to remember, that is fine. Air, you can clearly see the color of the cylinder. This is gray cylinder, gray body with black and white shoulders. You can see gray body. And what does this gray body indicates? Pose carbon dioxide. So gray body indicating carbon dioxide and black and white shoulders indicating oxygen. And the pressure is same that of oxygen, that is 2000 pounds per square inch. 2000 psi. And why 2000 psi and why this air is exhibiting the pressure of oxygen? Because that's a general rule of physics. You know that if you mix two gases with different pressure, the combination will always exhibit the pressure of higher gas. That is why air is exhibiting the pressure of oxygen. Another cylinder that is used is Antonox. And Antonox is a mixture of 50% oxygen and 50% nitrous oxide. And that is why The color is blue body with blue and white shoulders. And of course, blue body with blue shoulders indicates nitrous oxide, and the quadrant of white shoulder indicate oxygen. And what should be the pressure? Will it exhibit the pressure of nitrous oxide or will it exhibit the pressure of oxygen? Which is higher? Oxygen. So obviously the pressure will be 2000 pounds per square inch. So any gas combination carrying oxygen will exhibit the pressure of oxygen that we have seen. Entonox carries the pressure of oxygen 2000. Similarly, air also has oxygen, so it also carries the pressure of oxygen. So just we can rapidly summarize. Oxygen stored in black body with white shoulders at a pressure of 2000 psi, and the most commonly used cylinder is type B, which has content of 1600 liters, while the type of the cylinder attached to anesthesia machine is type E. Nitrous oxide is stored in blue color cylinders at a pressure of 760 psi. Carbon dioxide, gray cylinders, but not used in anesthesia, as I told you. Air, gray body indicating carbon dioxide, and black and white shoulders indicates oxygen, and the pressure is 2000 psi. Antonox, which is a combination of 50% oxygen and 50% nitrous oxide. So the color is blue body with blue and white shoulders. Blue body with blue shoulders indicating nitrous oxide and white shoulders indicating oxygen, and the pressure is 2000 pounds per square inch. So that is all about cylinders. Now let me see any technical glitch. No, great. Now, in the larger hospitals or the bigger hospitals where the consumption of gases is more, of course, it is not possible to change cylinder every time. So there, these gases are supplied through central supply room. There's a central supply room in the hospital which has very big cylinders, jumbo size cylinders, and from those store through central supply pipelines, oxygen is directly delivered to operation theater. Through central supply, it is oxygen, nitrous oxide, and air that is being supplied. That is why I was telling air cylinder, if you want to skip, that is also fine because air is almost always supplied through central supply. Even all modern machines, they don't have any provision for attachment of air cylinder at the anesthesia machine. So mostly it is oxygen and nitrous oxide cylinders. Anyways, so through central supply, this oxygen, nitrous oxide, and air are supplied at a pressure of 60 pounds per square inch. 60 psi. In your books, you will find either the answer given is 50 psi or 55 psi, depending from which book they have picked. Because in US it is supplied at a pressure of 50 psi, and in UK it is supplied at 55. So you need not remember about UK and US. In India, the central supply is at a pressure of 60 psi. And there is color coding for the pipes also. So oxygen will be carried by white color pipes, nitrous oxide by blue color pipes, air by black pipe. Then there is fourth pipe also that you will see yellow, and that yellow pipe is for central suction or vacuum. So this pipe, white pipe, obviously is for oxygen. This blue pipe is for nitrous oxide. This black pipe obviously is for air, and this yellow pipe is for vacuum, central suction. Now this transparent pipe, you can see also one more pipe. This is for scavenging. That we'll discuss later. Scavenging means removing these extra anesthetic gases from operation theater. That we'll discuss later, but just here you can note that this is a big transparent pipe. This is for scavenging. So scavenging pipe is removing gases. Rest all other pipes from central supply are delivering gases to the operation theater. Fine. So that is how now you can say what are our sources of gases? Sources of gases may be central supply, and through central supply, obviously through the pipes, it will be delivered to anesthesia machine. And second is cylinders. Source is cylinders. And of course, cylinders will be directly attached to anesthesia machine. Now, another very important thing is that the central supply or cylinders, they are being attached to anesthesia machine. If they get attached wrongly, then it can be disastrous. Means by chance, if nitrous oxide pipe gets attached to the oxygen pipe or nitrous oxide cylinder at the place of oxygen cylinder and patient receive 100% nitrous oxide, patient is definitely going to die. So there should be something which prevent the wrong fitting of the central supply pipelines and wrong fitting of cylinders to the anesthesia machine. And that portion, that interface which prevent wrong supply of cylinders to the anesthesia machine is called as pin index system. So pin index system is what? It is to prevent a wrong fitting of cylinders on anesthesia machine. So pin index system is the system which is used to prevent wrong fitting of cylinders on anesthesia machine. So just no need to go in all those details, but just for your understanding, I'll make you understand that what exactly this pin index system is. Actually, they have divided 7 pinpoint positions for each, means for these gases, say 1, 2, 3, 4, 5, 6, 7. When we say pin index for oxygen is 2,5, means the part of the anesthesia machine where oxygen cylinder will be fitted will be having two pins at a position of 2 and at the position of 5. And at the same corresponding distance, there will be holes in oxygen cylinder. Now we say pin index position for nitrous oxide is 3,5, means the place where nitrous oxide cylinder is going to be fitted at anesthesia machine will have two pins at a position of 3 and at the position of 5. And at the same corresponding distance, there will be holes in oxygen cylinder. Now, if you try to fit nitrous oxide cylinder at the place of oxygen, will you be able to? No, because pins and holes will not match with each other. So, this is the portion where cylinders get fitted on anesthesia machine, and this portion where cylinders get fitted is called as yoke. So yoke is that part of the anesthesia machine where cylinders get fitted. Now say, for example, this is a yoke of, say, oxygen. So you can see these two pins. So what are the pin positions you are expecting here? That is 2 and 5. And say this is oxygen cylinder. So what are the holes you are expecting? That is 2 and 5. And that you can see this is the oxygen cylinder. Can you see these two holes? These two holes. So the position of these holes is 2 and 5. And pin positions at yoke is 2, 5. So only oxygen cylinder can fit here. At nitrous oxide cylinder, this pin position will be 3 and 5, and hole position will also be 3 and 5. So nitrous oxide cylinder you cannot fit at the place of oxygen. So Now, I think you have understood that what exactly pin index system is. So you have to remember the pin index system. What commonly has been asked from you is the significance of pin index system. And the significance of index system is that it prevents wrong fitting of cylinders. And pin index position, very often they ask. So pin index position at the yoke of the oxygen, the two pins are placed at a position of 2 and 5. And as I told you, at the same corresponding holes, at the same corresponding distance, there will be holes in oxygen cylinder. Pin index position for nitrous oxide is 3 and 5. Antonox has only one pin at a position of 7. At a position of 7, air, nowadays I told you, air cylinder is not used. However, if you still want to use, pin index position for air is 1 and 5. So books you will find for carbon dioxide, cyclopropane, no need to remember at all because they are not used, and all modern machines, they have only facility for using two cylinders, that is oxygen and nitrous oxide. Antonox again is not used through anesthesia machine. It is used separately, and the uses of Antonox we'll discuss later, then you will better understand. And air also is given through central supply. So there is no provision even for air cylinders also. So practically important is you have to remember oxygen pin 2 and 5 and nitrous oxide pin 3 and 5. These two are optional. Antonox 7, air 1 and 5. If you want to remember, fine. If you don't, then also it should be fine. But better you remember by chance if they ask a question. So better to remember. Now, this is all what we have discussed about the possibility of avoiding wrong fitting with cylinders. Now, central supply pipelines can also get wrongly fitted. So for that, the simplest system they have devised is diameter index safety system DIS. So as the name suggests, diameter index safety system means there will be different diameter of these pipes. These pipes where they are getting attached in the slot, they all have different diameters. That means if you try to place nitrous oxide at the place of oxygen, it will not fit because the diameter of this pipe will not fit in the slot of oxygen. Similarly, air also will not be able to fit at the place of oxygen because the slot for air is different, having different diameter from slot of oxygen or nitrous oxide. So each pipe has different diameter which can fit only in the socket meant for that pipe. So diameter index safety system, you can say, is to prevent a wrong fitting of central supply pipelines. So diameter index safety system is to prevent wrong fitting of central supply pipeline. So these two are very important systems. Diameter index safety system to prevent wrong fitting of central supply pipelines, and pin index systems to prevent the wrong fitting of cylinders. So here, when this central supply or cylinder is attached here, so what is the most important thing here? That is pin index system and diameter index safety system. This and this we normally say. Pin index system and diameter index safety system, which prevent the wrong fitting of cylinders and center supply. Fine. So this is how gases from source has reached the anesthesia machine, and at anesthesia machine we have ensured that wrong gas is not delivered to the patient, because delivering wrong gas, I told you, delivering 100% nitrous oxide is definitely going to kill the patient. So now gases has reached the anesthesia machine. Now what happens in anesthesia machine to these gases? So that we'll discuss in this section. Anesthesia machine. Gas flow. how the gases flows in anesthesia machine. Now let me see any technical glitch. No, there's no technical glitch. Great. So how the gas flow occurs in anesthesia machine. So what I'm drawing here is just the outline of anesthesia machines to make you understand that how actually these gases they flow in anesthesia machine. So you can draw it with me so that later we can understand, we can spend more time in understanding. So what I'm drawing here is just the outline of the anesthesia machine. So hope you have drawn. I'll just wait for 30 more seconds. So if you're not drawn, you can draw so that we can discuss. Okay. So this is the portion where cylinders or central supply are going to be attached. And the portion where central supply or cylinder is going to be attached, I told you is called as yoke. Now say this is yoke for oxygen and say this is yoke for nitrous oxide. So obviously oxygen cylinder or central supply will be attached here. But the pressure in cylinders and central supply is very high. 2000 pounds per square inch in cylinder and 60 pounds per square inch in central supply. That pressure is too high. 2000 can burst everything in this room. So it's too high pressure obviously is not acceptable. So here there are pressure reducing valves. So these are pressure reducing valves. Now, how much pressure is reduced by each valve? There are two valves, so that details, of course, is not required for you. They don't ask that much details from you. Yes, but you have to remember that, of course, pressure has to be reduced drastically. Otherwise, even that can burst your anesthesia machine pipes. So pressure is reduced drastically, and after that much of the pressure reduction, this oxygen will pass through its flow meter tube. So this is oxygen flow meter tube. Say this is nitrous oxide flow meter tube, and this is say air tube. Now, similarly, nitrous oxide will also pass through these two pressure reducing valves. And after pressure reducing valves, of course, it is going to pass through its flow meter tube. Now, this flow meter tube has a flow control knob, this knob. So by rotating this knob, you can decide that how much gas should enter this tube. So you can say it's kind of flow control knob, that by rotating this knob, you can decide that how much flow should enter the tube. And this tube is a glass tube having markings indicating flow in liters per minute, you can say, although we have micro tubes also in milliliter also, but generally for your convenience point of view, you can say flow is in liters per minute. Now, these I told you are glass tubes, transparent tubes, but still you cannot see the gas flowing through it. Cannot see a gas, but we have to be sure that gases are flowing. Not only flowing, we have to set the flow rates. So for that, what they have done, they have devised a aluminum structure into each of this tube, which is called as bobbin. Bobbin. Now, how does this bobbin work? In its upper rounded part, there are cuts. So when a gas pass all around this bobbin, due to these cuts, it will make the bobbin to rotate. So if your bobbin is rotating, that indicate that your gas flow is continuous. If your bobbin is rotating, that means your gas flow is continuous. One thing. Second, it is the upper level of the bobbin which determine the flow rates, not the mid level or lower level, upper level. So you can understand now whatever important we'll write later, no problem. So just now you can focus on understanding the mechanics. Important point, what you have to write, I will write with you. But right now you just try to understand. So it is the upper level of the bobbin which determine the flow rates. Now similarly say there is a bobbin for nitrous oxide. And similarly there will be bobbin for air also. Now if I ask you how much oxygen is being flowing in this tube, upper level is corresponding to 8. That means we are giving oxygen at a rate of 8 liter. How much nitrous oxide we are giving air? Corresponding to upper level is 5. That means we are giving nitrous oxide 5 liter. If I want to increase nitrous oxide, I will rotate this knob. More gas will come and bobbin will go up. And that is how we can set my flow rate. Or I want to increase the oxygen, I'll rotate this. I want to give say 9 liter. So I will rotate it, bobbin will go up, and the point when bobbin reaches at 9 liter, I will stop. That means that is how I am setting my flow. Now, how much flow we are keeping in anesthesia machine, that we'll discuss later. And this whole unit, this whole unit containing different flow meter tubes and flow control knobs. This whole unit containing different flow meter tubes and flow control knobs is called as a rotameter. So why it is called rotameter? Because it has rotating bobbin in it. After the name of this rotating bobbin, it is called as rotameter, because this rotating bobbin guarantees us, ensures us that gases are continuously flowing. So because of this rotating bobbin, this structure is called as a rotameter. So finally, all these gases, they will combine at the top of the machine, and from there they pass through an instrument which is called as a vaporizer. Vaporizer. So vaporizer is the instrument which contains inhalational agent. Say it is filled with inhalational agent, volatile agents. So volatile agents, as the name suggests, means they are volatile. Volatile means they get evaporated. So when a gas mixture will pass over this volatile agent, due to the pressure of the gas will get evaporated, vaporized, and these evaporated particles will mix with this gas mixture. So this volatile agent can be anything: halothane, isoflurane, sevoflurane, desflurane, whatever you want to use. So it will mix with these gases, and the final mixture which is delivered from machine outlet is called as fresh gas flow. Later we will be using it as short form FGF. So always we'll be using the short form FGF. which is fresh gas flow. So this term we are going to use very, very commonly in future. So fresh gas flow is the final mixture which is coming out from anesthesia machine, and it comes out at a pressure of 5 to 8 psi. Imagine here, if it is oxygen cylinder, what was the pressure? 2000 psi. And what patient is getting just 5 to 8 psi. So now you can imagine that how drastically these pressure reducing valves are reducing the pressures. And this final mixture, that is fresh gas flow, usually consists of 75% nitrous oxide or air, whatever you want to use, plus 25% of oxygen and plus one of the volatile agent. So this is a very, very important fact that you must know, that whatever may be the condition, oxygen concentration should never be allowed to fall below 25%. And this they have asked n number of times in your exams also, that what should be the minimum concentration of oxygen, what should be the optimal concentration of anesthesia gas mixture. So it must not be less than 25%, because if it becomes less than 25%, patient can develop hypoxia. Normally, we are surviving at 21%. Air has 21% oxygen, but there are some minor leakages in anesthesia machine. So to compensate for these leakages, we just keep a margin of extra 4 to 5%. That's why we are giving 25%. Fine. So important thing, what you have to remember, we have seen is that in anesthesia machine, what is the most important, uh, you can say, processing which are happening? Three most important thing: pressures are getting reduced, we are setting the flow rates, and we are adding the volatile agents. So these, you can say, are the three most important processes which happens in anesthesia machine: pressure reduction, setting of flow rates, and addition of volatile agents. So these, there are many other things are also happening, but again, that much details are not required for you. So the most important thing happening are pressure reduction, setting of flow rates, and addition of volatile agents. So these are the three most important thing which you have processed in your anesthesia machine. So now we can see the pictures also to give you more visual impression. So this is what I was talking is rotameter. You can see this rotameter. So this is the bobbin, you can see clearly this bobbin. So this is oxygen knob, and you can see the color coding also. White color knob, written also oxygen symbol. And nitrous oxide knob, you can see it is blue. And this is just to give you visual safety. Say I want to switch on oxygen. So by mistake, I don't open nitrous oxide. So just to give a visual safety, they made them color coded, and you can see black for air. And that I told you, this is bobbin. I think you're not able to see from here. Otherwise, you can see flow also, like here. Nitrous oxide is flowing at a flow rate of, this is 2 liter, 3 liter. This is 3 liter approximately. And oxygen we are seeing is here 1, 2, 3, 4, 5 liter. If I want to increase oxygen, I will rotate this knob. More gas will come, and bobbin will go up. If I want to increase nitrous oxide, I'll rotate this knob. more nitrous oxide will enter the tube and bobbin will go up. That is how we can set the flow rates. So rotameter, important thing that this knobs are color coded, flow control knobs are color coded, and secondly, it is the upper level of bobbin which determine the flow rates. And why I'm telling this, because they've asked also this question once or twice, that it is the upper level, mid level, lower level, like that. So it is the upper level of the bobbin which determine the flow rates, and the flow control knobs are also color coded. So of course it will be white for oxygen, black for air, and blue for nitrous oxide. Then another important component of anesthesia machine I told you is vaporizer. And vaporizer are used for the delivery of volatile agents, inhalational agents. So four volatile agents which are commonly used nowadays are halothane. We'll discuss all in detail. Halothane, isoflurane, sevoflurane, and desflurane. So these vaporizers, they are used for the delivery of volatile agents. Now important, not that important, I'll say high yield for you, is that there is a color code which is defined for each of this vaporizer. Halothane, and not only vaporizer, actually bottle of the vaporizer will also have the same color. Like for halothane, the color code is red. For isoflurane, the color code is purple. So vaporizer as well as bottle of isoflurane will be of purple color. Sevoflurane, it is yellow, and desflurane, it is blue. Now you can see yellow knob from distance means this is which vaporizer? Of course, it is sevoflurane vaporizer. Blue knob, that means it is desflurane vaporizer. So that is how actually you can identify vaporizer from a distance. No need to read all those somewhere. They write also here. You can see it is written also sevoflurane. But no need to read from distance. We can tell that this is a sevoflurane vaporizer, this is a desflurane vaporizer. Halothane vaporizer will have red code. Somewhere it is knob color, somewhere this front part is of that color. Different companies has different, but somehow they will mention the code on the vaporizer, color code on the vaporizer. So is red for halothane, purple for isoflurane, yellow for sevoflurane, and blue for desflurane. So this is the old anesthesia machine, and you know that older times anesthesia machine used to be called as Boyle's machine. Why? Because the first anesthesia machine was actually manufactured by a scientist called as Boyle's. So Boyle's machine. So this is the Boyle's machine. You can see this is the yoke. Yoke. So obviously cylinder or central supply will be fitted here. And these are the pressure gauges which are telling you how much is the pressure in central supply or cylinder. Then there will be pressure reducing valves inside. You cannot see from outside, they are the inside part. And after this pressure reduction, gases will pass through this rotameter. So this is of course rotameter. And then these are the different kind of vaporizers. But this is an old machine. So nowadays, none of this vaporizer, this is ether, trilene, none of these are being actually used nowadays. Halothane still used, but it is a very old model of halothane vaporizer. Then, this Boyle's machine you can see is very basic. You can see this is a ventilator, is not the part of machine. It is separately attached to anesthesia machine. Similarly, look at these monitors. They are also very basic. So nowadays, what we get everything consolidated at one place. That is why nowadays anesthesia machines are actually called as anesthesia workstation. You can see a modern day anesthesia machine. So this is ventilator. And you can see that ventilator is the part of anesthesia machine integrated. Similarly, look at this monitor, such a big monitor. So this is also usually coming attached to anesthesia machine. And you can see lot of store capacities are there, drawers are there, tray is there. So these we can use to store our equipments which we are going to use during anesthesia. Means everything is available at one place, consolidated. That is why these are called as anesthesia workstations. So here yoke will be at the back of the anesthesia machine. So this is a front view, we cannot see. So cylinders or central supply will be fitted here. Then inside the machine, there will be pressure reducing valves. And this you can see is rotameter. You can click, it's a color diagram. So you can see also, this is oxygen, white, this is air, and this is blue, nitrous oxide. And from there, gases will go to this vaporizer, and this has a blue knob. So this is a vaporizer of gas filtrate. Fine. So that is all about anesthesia machine or anesthesia workstation. So most important thing, which we have already seen, three most important things which happen in anesthesia machine is or are pressure get reduced, we set the flow rates, and we add the volatile agent. So these are the three most important thing about anesthesia machine. And then another very important thing about anesthesia machine is that it has got a safety mechanism, pin index system and diameter index safety system, which ensures that wrong gases are not delivered to the patient. Now gases from anesthesia machine means here what is that? Fresh gas flow. Now this fresh gas flow will be delivered to the patient through these breathing circuits, breathing tubes. So now we are going to discuss about these tubings, breathing circuits. So breathing circuits or tubings are nothing. They are just, you can say, are the tubings, circuits are tubings connecting anesthesia machine to patient for delivery of fresh gas flow. I told you gases coming out from anesthesia machine are called as fresh gas flow. So circuits are the tubings which deliver anesthesia gases or fresh gas flow from anesthesia machine to the patient. Now let me see any technical glitch. No, great. So what are these breathing circuits? Before starting breathing circuits, few terminologies we have to discuss because we will be using these terminologies later. So you have to understand fresh gas flow, and I told you later we will be writing is FGF. So what is the fresh gas flow? Gases exiting from machine outlet. And I told you usually it consists of 75% oxygen, 75% nitrous oxide or air, 25% oxygen, and one of the volatile agent. Rebreathing, as the name suggests, rebreathing means patient is rebreathing his or her expired gases. So rebreathing means breathing of expired gases. Again breathing, rebreathing is the expired gases, and expired gases means what? Carbon dioxide means patient is re-inhaling the expired carbon dioxide. Then spontaneous ventilation, SV. Spontaneous ventilation means patient is taking his or her own breathing, spontaneous breathing. And controlled ventilation, later we'll be using short form CV. Controlled means ventilation is controlled by ventilator. Controlled ventilation means ventilation by ventilator if your machine is attached with ventilator, or if you are using manually, then ventilation with bag. So controlled ventilation means ventilation provided by the machine. Controlled means patient doesn't have a spontaneous breath. You with bag or machine with ventilator is controlling the ventilation of the patient. And very often this is the scenario in general anesthesia. Because in general anesthesia, later we'll discuss that we are giving muscle action to paralyze the patient. So patient is paralyzed. So you have abolished the spontaneous breathing. So ventilation is controlled by ventilator. Patient is not having spontaneous breathing. So with this background in mind of these few terminologies, let's first classify these breathing circuits. They are broadly classified as open, semi-open, semi-closed and closed, which actually are called as circle system. So now why they are called circle system and what is the difference between these semi-closed and closed, that we'll discuss later. Open, as the name suggests, means you directly pour inhalation agent over patient mouth and nostril. So this was actually applicable more or less for ether or chloroform. A layer of gauze paste is put over the mouth and nostril of the patient, and then ether is directly poured from the bottle and patient will inhale ether. Now the disadvantage of this open technique is you don't know how much percentage you are giving. If you see our vaporizers, they are calibrated in points. You can deliver 1%, 1.1%, 1.2%. And here you don't know the percentage. Arbitrarily you keep on pouring. So you cannot control the depth of anesthesia. And secondly, when the patient is expiring into atmosphere, leading to a lot of theater pollution. And you are standing near the patient. So you may inhale more than the patient. So anesthetist getting anesthetized, that possibility was there with open. So that is why actually open system are totally obsolete. Obsolete. Open system nowadays are only used by kidnappers, otherwise they are obsolete. Semi-open, now they have made some changes to the definition. So for a code also, in future, if I'm using green pen, that means this is a recent advancement or a recent change. A circuit is going to be called as semi-open if the fresh gas flow requirement is equal to or more than minute ventilation of the patient. Later I'll write short form MV. So if the fresh gas flow requirement from the anesthesia machine is more than minute volume of the patient, circuit will be classified under semi-open. And how much is the minute volume? For a normal adult patient, if we say minute volume is how much? Minute volume is what? What? Respiratory rate into tidal volume. So respiratory is 12, tidal volume is 500. So you can say around 6 liter. So if the fresh gas flow requirement from anesthesia machine is equal to or more than 6 liter, the circuit will be classified under semi-open category. However, if the fresh gas flow requirement is less than minute volume, circuit will be classified under semi-closed, closed or circle system. So this is a very important, you can say, recent advancement. And because of this new definition, actually nowadays, these semi-open circuits, which were described by Meffelson, falls in category of semi-open. All your books, you may find Mephielson circuits to be classified under semi-closed category. But now this newer definition or clear definition classify this Mephielson circuits under semi-open because fresh gas flow requirement in Mephielson circuits are equal to or more than minute volume. Clear? So Mephielson described these semi-open circuits and he described these circuits from A to F. Actually, he described A to E. F was added by someone else. So of course, that details are not required. So simply you can say his Mephielson circuits are from A to F. Now let's see the basic important highlights of these Mephielson circuits. Too much details are of course not required and not possible. So what is important that I'm going to tell you? Mephielson A is also called as McGill circuit. Is also called as McGill circuit. So this is how the McGill circuit appears. So of course, one end should be machine end. So this is the machine end, which will be fitted at the machine end. And of course, this is the patient end. So it will be connected to the patient either through mask or through endotracheal tube, whatever method you are using. And this is an expiratory valve. Fine. So fresh gases, which I'm showing here as say green line. These fresh gases from anesthesia machine will pass through this tube and then will be delivered to the patient, no doubt. Now the expired gases, which I am showing here as these blue dotted lines, most of these expired gases will vent out into the atmosphere through this expiratory valve. They will be vented into the atmosphere. However, some of these gases can go back into the tubing, and these gases which have gone back into the tubing may be re-inhaled by the patient in next breath. That means there occur rebreathing. And I told you rebreathing means breathing of expiratory gases. So these expiratory gases patient may re-inhale, but that we never want. We never want that patient should inspire his expired gases. So aim of every circuit is that there should not be any rebreathing. Now, how to control this rebreathing? What they suggest that you determine adequate or you provide adequate fresh gas flow from the machine so that these expiratory gases, due to the push of these gases, will get first vented out through the atmosphere and then patient will receive the inspiratory gases. Now, how much flow you should keep in each kind of circuit, that is how it is calculated is much beyond your scope, but you have to know that from this kind of circuit you have to maintain this much fresh gas flow to prevent rebreathing. So fresh gas flow recommendations for McGill circuit is, and as I told you, these recommendations are meant to prevent rebreathing. So simply you can remember is that fresh gas flow recommendations, which we are going to discuss here, are meant to prevent rebreathing, and how it is calculated is of course much beyond your scope. and they actually have done years and years of study to find that what is the most appropriate fresh gas flow for this kind of circuit, which involve lot of physics. So fresh gas flow requirement for McGill circuit is that if you are using it for spontaneous ventilation, then fresh gas flow requirement should be kept equal to the minute volume of the patient. Means if the patient is spontaneously breathing, you need to give how many liters of fresh gases? Minute volume is how much? 6 liters. So you have to give 6 liters. Out of this 6 liter, 75% should be nitrous oxide and 25% should be oxygen. So 75% of 6 liter means how much? Around 4.5 liter. So 4.5 liter you will provide nitrous oxide and 1.5 liter you will provide oxygen. That is how I told you you have to set the flow rates. So setting of flow rate will depend which circuit you are using, or patient is spontaneously breathing, or patient is on controlled ventilation. Fine. If you use this circuit for controlled ventilation, it has been seen that fresh gas flow requirement become very high. Very high means more than 3 times of the minute volume. More than 3 times of the minute volume means around 18 liter, which is practically not possible. So therefore, McGill circuit is not recommended for controlled ventilation, or you can say it is the circuit of choice for spontaneous ventilation. So McGill circuit of choice. Later I'll use short form COC. Circuit of choice for spontaneous ventilation and avoid for controlled ventilation. So McGill circuit is the circuit of choice for spontaneous ventilation, and it should not be used for controlled ventilation, because for controlled ventilation, fresh gas flow is very high, more than 3 times of the minute volume, while for spontaneous ventilation, it just require fresh gas flow equal to the minute volume. So initially, actually, Mapleson were making some changes in McGill circuit. Like in type B, he bought this expiratory valve from here to here. So that become a disadvantage, circuit become obsolete. In type C, he reduced the length of the tubing. So circuit again become ineffective. So B and C, you can say, are obsolete. B and C are obsolete, no more used. Then Mapleson D. Mapleson D as such was not a, this is Mapleson D. So Mapleson D as such was not a big advantage, but a modification in Mapleson D was made by scientist Baines. And what modification he had? He made this Mapleson D to become coaxial. Coaxial means one tube passes through other tube, that is coaxial. So what Baines did, he incorporated inner tube, you can see this green inner tube, into this outer tube of Baines circuit. So he incorporated an inner tube into Mapleson D, that becomes Baines circuit. So of course, needless to say, now fresh gases, so this will be attached to anesthesia machine. So fresh gases through this tube will enter this Baines circuit, and you can see this green tube is going all along the length. So fresh gases will go to the patient through this inner tube, will be delivered to the patient. Expiratory gases through the outer tube. So there is no mixing in between. So the only mixing point is this small point where the fresh gases tube ends. So this is the only point where there is a possibility of mixing. So mixing possibility is drastically reduced. So that means this Bain circuit become very effective. So and so that you can say that Bain's is the most commonly used semi-open circuit. So Bain's is the most commonly used semi-open circuit. Fresh gas flow recommendations for Bain circuit. If you are using it for controlled ventilation, then fresh gas flow requirement will be 1.5 to 2 times they say, but for an average you can remember is 1.6 times of minute volume. If you use it for spontaneous ventilation, then fresh gas flow requirement is high, that is 2.5 times of minute volume. So obviously, we always prefer a circuit which uses less gases, and you can clearly see that Bain's is using less gases during controlled ventilation, making it as a circuit of choice for controlled ventilation. And of course, avoid for spontaneous ventilation because fresh gas flow is very high. So until now, these are the adult semi-open circuits. Next to that is Mapleson E and F. They are the pediatric semi-open circuits. So Mapleson E and Mapleson F are the pediatric semi-open circuits. So Mapleson E, also called as IRAs, T-piece, nothing. So as the name suggests, means you can see there is a T-piece. To this T-piece, a tubing was attached by IRA, scientist IRAs. So that becomes IRAs T-piece. But it's not a complete circuit because to have a complete circuit, there should be breathing bag, but there's no bag attached here. So it is actually, you can say, is a incomplete circuit. So obviously, one portion of this T is attached to tube, one portion for fresh gas flow, and one portion obviously to the patient. So as I told you, it is an incomplete circuit because it does not have breathing bag. So it was made complete by just attaching a breathing bag to it by scientists Jackson and Rees, which is also called as Mapleson. So you can see they just attached a breathing bag to this Mapleson E, which is just, you can see, a T piece to which the tube was attached. Until here, it is Mapleson E. Bag was attached, so it becomes Jackson and Rees. So Jackson Rees or Mapleson F, you can say, is simply modification of IRA's T piece, which was a incomplete circuit. So fresh gas flow recommendations for Jackson Rees, very simple to remember. Fresh gas flow requirement are equal to minute volume. Simple. No need to remember another figure. Simple are equal to fresh gas recommendations are similar to Bain's. Fresh gas flow recommendations are similar to Bain's. That means 1.6 times for controlled ventilation and 2.5 times for spontaneous ventilation. But unfortunately, for pediatric patients, we don't have option of other circuit. So even for spontaneous ventilation, fresh gas flow requirement is high. We have to use because we have only one circuit for pediatric that is available, and that is Jackson and Rees. which is also called as methylson F. And it is not that it is used for all ages. It is only used in children less than 6 years or less than 20 kg. So not for every age we are using Jackson Rees. It is used for children less than 6 years or less than 20 kg. So now let's just summarize these circuits, semi-open circuits. So semi-open circuits, they were described by the Mapleson. As I told you before also, in books you may find Mapleson being classified as semi-closed, but that is changed now. Now their category is semi-open because we have seen that fresh gas flow requirement in Mapleson circuits are always more than minute volume. So they are semi-open. Mapleson A, also called as McGill circuit. It is the circuit of choice for spontaneous ventilation, and fresh gas flow required for spontaneous ventilation is equal to the minute volume. And it should not be used for controlled ventilation because fresh gas flow requirement is very high, more than 3 times of minute volume. B and so fresh gas flow we already discussed on this page. So B and C stand obsolete. They are no more used. A modification of D, Baines is the most commonly used semi-open circuit, and it is the circuit of choice for controlled ventilation, and fresh gas flow required for controlled ventilation is 1.6 times of minute volume. Similarly, it should be avoided for spontaneous ventilation because fresh gas flow requirement is higher, that is 2.5 times of minute volume. Mapleson E pediatric circuit, which is also called as IRSTPs, and it was an incomplete circuit. So it was made complete by two scientists Jackson and Rees, which is also called as Mapleson F, which is most commonly used pediatric circuit, or in fact you can say the only pediatric circuit that is used, not even most commonly, the only pediatric semi-open circuit that is used is Jackson Rees, and it should be used in children less than 6 years or less than 20 kg. And very simple, fresh gas flow recommendations are similar to Baines. Now, many times you will see picture questions without, they will just give you the image of the circuit and you then they will ask questions. So you can easily identify if they are giving a inner tube, and always in the diagram they will show a inner tube entering the outer tube. So if a inner tube is entering the outer tube, it is Baines coaxial. If there is only single tube, no inner tube entering, then it is obviously McGill. Pediatric, how you will identify? You can easily identify because you will find that somehow they will always give that there is a kind of T piece. And to this T piece, you will find a tube attached and a bag attached at the end. And look at the tube diameter. Compare. Just tube diameter and compare here the tube diameter. Here you cannot confuse with Baines because there is an inner tube. Maybe you can you get confused with Bain this Mapleson. So look at the tube diameter here. So you can easily make it that it is Baines. It is McGill. So and obviously in always I've seen when they give you Jackson Rees, they will you can easily identify there will be a T piece attached tube like that. Fine. So let me see if there is any queries or something. No, fine, great. Now, semi-closed or closed circuit. So semi-closed or closed circuit, just let's draw the line diagram to understand it. This is for fresh gas flow. This will be connected to the patient. This is the expiratory limb of the closed circuit or semi-closed circuit. And this is the inspiratory limb. Obviously, inspiratory limb will have fresh gas flow. And this is the canister containing soda lime. Containing soda lime. Now, the expiratory gases, which I'm showing here as blue line, this expiratory gases will pass through the expiratory limb and it cannot enter the inspiratory limb because there are valves here. So these are the valves which are unidirectional so that expiratory gases cannot enter the inspiratory limb and inspiratory gases cannot enter the expiratory limb. So these expiratory gases will pass through the expiratory limb and from there they pass through the canister containing soda lime. So what this soda lime will do? It will absorb carbon dioxide from these gases and the same gases can be reused by the patient. Now, the same gases are in circulation. Expiratory gases, after getting soda lime being absorbed, is reused by the patient. So same gases are being reused. Gases are in circulation. That is why these circuits are called as circle system. Now, what is the difference between closed and semi-closed? Why we say them closed? Because gases are not venting out into the atmosphere. To say a circuit closed means no gases are venting out into the atmosphere. Open, everything is venting out to the atmosphere. Semi-open, although also gases are venting out in majority gases are venting out into the atmosphere, but some are going back into the tubing, which could cause rebreathing. While closed circuit, the same gases should be reused after complete absorption of carbon dioxide by soda lime. No gas should vent out into the atmosphere. So this circuit should be closed. But actually this never happens. There are so many points here, 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 here. There are around 12 or 13 points where there can be leakages. Although leakages may be minor, but these leakages allow some of the gases to vent out into the atmosphere. So they say actually closed circuit is just theoretical phenomena. Every closed circuit is behaving like semi-closed circuit because gases are venting, some gases are venting out into the atmosphere. Majority are closed, but some are venting out, so it is semi-closed. So that is why now they say that avoid these confusions terminologies. So therefore, nowadays, actually, these closed, semi-closed circuits are only called as circle systems. So they say don't use these terminologies. Of course, the criteria that fresh gas flow requirement is very low, very low, far lower than minute volume for both. So obviously, they will be classified under semi-closed, closed or circle system. So now closed, semi-closed terminologies are not advisable, discouraged, and we have to use circle system. So you can see here the diagram. This is the inspiratory limb, inspiratory tubing or inspiratory limb. And how we say inspiratory tubing or inspiratory limb? Because there is an oxygen analyzer. So in the limb where oxygen analyzer is fitted, that means this is the inspiratory limb. Although in written also there will be either arrow like that, or some machines it will be written in I or E, or some machine INSP or EXP. So it is written also, but oxygen analyzer will always be on the inspiratory limb because this is telling you the final delivered concentration of oxygen to the patient. And this another limb obviously will be expiratory limb, and these are the valves I was talking about, which ensures that there occur unidirectional flow of gases. So one of the very important component of circle system is soda lime. Soda lime, because it is the soda lime which plays a major role. It absorb carbon dioxide, and that is how the same gases can be reused. So soda lime, for the composition of soda lime, I am using the green pen. Why? Because there is a very major change in the soda bicarb which is being used today. And what is the change? I'll tell you. The most important component is calcium hydroxide, 80%. 80% is calcium hydroxide, sodium hydroxide, 3%, potassium hydroxide, 2%, and then 15% is the water. This is the change. Older times, maybe in few old editions of the books, you will find that it is given calcium hydroxide 95%, no water. So that is a major change and a very important change. The significance of that we are just going to see that the currently used soda lime has 80% calcium hydroxide. They have reduced calcium hydroxide from 95% to 80% and replaced it with 15% of water. Why? I'll tell you the significance later. Then there is silica, and silica is there to prevent dust formation. Otherwise, what happens? This soda lime granules, they can break and form the dust which may be inhaled by the patient. So to make them hard so that they doesn't break, they are adding silica. Then there is a color indicator which tells whether the soda lime is fresh or has been exhausted. And there are many color indicators which are being used, and different countries are actually using different color indicators, but you need not remember color indicators because in your books you will find so many mimosas red, phenolphthalein, ethyl violet, so many different colors. So of course you need not remember about other countries, you only remember about India. And India, the most commonly used is Durasol. Durasol, the color of which is pink when fresh, and it converts to white on exhaustion. So simply if they ask you what is the color of soda lime, when fresh it is pink and it changes its color to white when it get exhausted. So that is how we can see the color. Now the soda lime color has been changed to white, means now it will become ineffective. So we have to replace or change the soda lime in the soda lime canister. Now, comparison. What are the advantages of circle system over Mapleson? The biggest advantage is, I will say, low flow. How much flow you would use? How much flow is needed in circle system? Same gases are being reused. So the only oxygen consumed by the body need to be replaced. And how much is the oxygen consumption per minute? Oxygen consumption per minute is, must have read in physiology, 250 ml per minute. Means this 250 ml of oxygen need to be replaced. 250 ml, if you are giving oxygen, how much nitrous oxide you will give? 75%, that is 750 ml. So total around 1 liter. You are giving 1 liter of gases. While if I compare with Semi-open circuits, the most commonly used semi-open circuit is veins. And what is the fresh gas flow in veins? 1.6 times of minute volume. Minute volume is how much? 6 liter. So 1.6 times of 6 liter means around 9.6 liter. So in veins, you are using 10 liter. And here you are using 1 liter. So imagine. And that is why actually the kind of anesthesia that we give with circle system is actually called as low flow anesthesia. And that is why if by chance if they ask you about low flow anesthesia, means they are simply asking about circle system. And now I'll come to the rotameter to show you interesting thing. Look at the modern day rotameter. Are you seeing two tubes? Some some of you would have noted also. You can see there is two tubes for oxygen, two tubes for nitrous oxide. For air, it is still one tube. Why they have made two tubes? Because one tube is in milliliter and the second tube is in liter. What we are using in a circle system, 250 ml of oxygen. So that means we need a tube in ml. So this tube is in milliliter. Similarly, nitrous oxide, we are using 750 ml. So this is milliliter if you are using circle system. That is why these modern day machines where we are using circle system, they have two tubes, one indicating flow in milliliters, second indicating in liters. So the biggest advantage is low flow. And because of the low flow, obviously, they become very economical. Consumption of gases is so low. So obviously, they are very economical. And thirdly, no or almost no, you can say, negligible theater pollution. Only a minute gases which are leaking from circuits or machine, they may pollute the theater. While with semi-open circuit, all volume is exhaled into the atmosphere. So negligible theater pollution. So these are the main advantages for which actually we nowadays, if you ask me, we are only using semi-open circuits if we are not available with circle system due to one or other reasons. Otherwise, it's always circle system which are being used. Disadvantages: one, they are comparatively more complicated, or you can say heavy. Why? Because of these two tubings we have seen, see a circle system. Two big tubings are there, and you can see canister is there. So this canister, two big tubings, valves, this make this circle system to become more complex and complicated and heavy. Then secondly, there is risk of dangerous hypercapnia. There is risk of dangerous hypercapnia. Why? If soda lime become exhausted. And more importantly, if this valve gets stuck, then expiratory gases will not reach the expiratory limb and they cannot be vented out into the atmosphere. So where they will go? They will accumulate in the patient and patient may develop dangerous hypercapnias. So that is another disadvantage, that there is risk of dangerous hypercapnias. And another disadvantage, they can form toxic compound with volatile agents, inhalation agents. So they are heavy and complicated. They can produce dangerous hypercapnias. And fourthly, they can produce toxic compounds with inhalational agents. And the most classical example of that was trilene. Trilene, by producing toxic compounds with uh, soda lime, could have produced cranial nerve damage, craniotoxicity, and ARDS. So trilene, by reacting with soda lime, could have produced craniotoxicity, permanent damage to cranial nerves, and ARDS. Both are definitely not acceptable complications. But fortunately, trilene is obsolete. Even in my lifetime, also, I have seen vaporizers of trilene with old machines, but I have never used trilene. And actually there was a lock also. As soon as you start the close, as soon as you open the trilene vaporizer, you there that closed circuit get cut out. So you actually even accidentally also cannot give trilene. Just can you please hold the device, sir? Call from hospital need to take it. Sorry, I had to take that was an emergency call from hospital. So anyway, what I was telling is that trilene could have caused craniotoxicity or could have caused ARDS. That's why it was absolutely contraindicated with uh, circle system. Now, second compound which can uh, produce toxic compound is sevoflurane. Sevoflurane, by reacting with soda lime, can produce a toxic compound called as compound A, which is nephrotoxic. Although the possibility of production of this compound A is very less, but it has been seen. So sevoflurane, which is being used nowadays, can produce a toxic compound called as compound A. Then if soda lime is desiccated means extremely dry. If soda lime is extremely dry, then it can really cause havocs with the desflurane, and in fact with other agents also. It will produce carbon monoxide, and this desiccated soda lime with sevoflurane can cause burns of the respiratory tract. So both of these complications are of course unacceptable at any condition. Carbon monoxide poisoning seen with desflurane or burns seen with sevoflurane, both are unacceptable complications, but fortunately the possibility of these complications is very rare. Why? Because soda lime getting desiccated is very rare. Why? Because when soda lime react with carbon dioxide, there is production of water. And secondly, we don't want to take any chance, and that is why modern day soda lime, they have added water also. So that now you can understand that why we have added water. Why we have added water? So that soda lime doesn't become desiccated to produce dangerous complications like burns of respiratory tract with sevoflurane and carbon monoxide poisoning with mainly desflurane, however with other agents also. So we can just have a now you can see we can have the look at this circuits. This you can see in this diagram. It's a color diagram. You can see one is the inspiratory tubing, second is the expiratory tubing, and here soda lime is fresh. So you can see it is a pink color, and older machines, this is the soda lime, and this is the inspiratory limb because obviously it is attached to ventilator. So it is an inspiratory limb. So obviously other limb will be expiratory limb. Fine. So just let's have a look at a video of anesthesia delivery systems that will give you a little more overview. So these are the gases which I'm telling. They are coming from central supply store, and the central supply I told you it has big storage of these gases, and from there through the central supply pipelines. And in my hospital, this may be around 200-300 meters away from operation theater. So you can see that through these pipes will be connected to this panel, and I told you, so this is a color codings. You can see also blue pipe will be obviously for nitrous oxide, and nitrous oxide because of this diameter can only fix in nitrous slot air. Similarly, this yellow pipe is for vacuum, black pipe is for air, and white pipe is for obviously oxygen. And this is the slot where it get fitted. So we'll see this is an oxygen pipe, and this diameter I'll try to fit in this air slot. I'm not able to do. I can only fit in oxygen slot. So this is diameter indexed safety system. This is very important to prevent wrong fitting of center supply pipelines. Similarly, you can see this diameter slot is there, diameter slot is there, so that cannot fit. See, so if I try to fit nitrous oxide, it will not enter. So this is an important preventive measure. Fine. And gases, and this also I told you, transparent pipe, that is for scavenging or removal of the excessive gases. So from there, you can see center supply panel. Now gases are attached to anesthesia machine. This is the back of the anesthesia machine. And this also has a diameter system. You can see this diameter will not fit in the nut of the anesthesia machine. Nitrous oxide will not fit into the oxygen nut. Similarly, oxygen will not fit in nitrous oxide. And back of the machine, you can see these are the two cylinders. Slot for two. This black is oxygen and this blue is nitrous oxide cylinder. And obviously here, what you are expecting, here you are expecting the pin index system. So at the back of the machine here, it will be the pin index system, which is going to prevent the wrong fitting of cylinders. Fine. And after that, so there will be pressure reducing valves inside the machine. So now I'm coming to the front side of the anesthesia machine. So these are the gauge which are telling you that how much pressure is there in the cylinder and how much pressure is there in the central supply. And if the pressure fall, actually machine start alarming also. So we can know that, oh, there is decreased in oxygen or decrease in nitrous oxide. And this is rotameter I told you. You can clearly see these are the rotameter tubes, flow meter tubes. Now I'm opening oxygen. Can you see this bobbin going up? Similarly, now I'm opening nitrous oxide. Can you see bobbin is coming up and I can set the flow whatever I want. This is this tube in milliliter and this is in liter. Now I'm opening air. Now I want to reduce oxygen by rotating this knob. This bobbin will go up or down and the upper level of the bobbin will set the flow rates. So that is how we set the flow rates. Now these are the vaporizers. So you can see this is a yellow vaporizer which is indicative of CO fluoride, and another is the purple. You can see this purple color. This purple color indicate that this is a vaporizer of isofluoride. So after this, it will reach the machine outlet, and you can see this is a circle system. You can see clearly two tubings. One is the expiratory tube, one is the inspiratory tube. So imagine the gas central supply, which is almost, you can say, 200, 300 meters away from our operation theater. From that, we are getting these gases to the patient. And through this mask, they will be delivered to the patient. Right? So that is how you can say just briefing about this anesthesia breathing systems. Let me see any doubt or queries. If you have any doubt or queries, you can post, then we'll take then we'll take a short break. If you have any queries or something, you can just post me related to this portion only. If you have any queries or something, just let me know. Okay, then fine. We'll take small break. भगवान ने कहा, वो ही जाओ। हाँ हाँ मतलब बाई चांस है। मैं वही तो मैं कह रही हूँ ये तुम्हारा। मैंने तुम्हें वही बोला था कि तुम चले जाओ, एक्चुअली डायरेक्शन का है।